Good evening. My name is Rebecca McGurnan. I am a family nurse practitioner student with ECPI University. I am also a registered nurse at a local emergency department located in the northeast corner of North Carolina. As an emergency room nurse for the last 8 years, I have noticed a drastic increase in the trend of opioid and narcotic overdoses that we have come through our doors. Because of this, I would like to speak on the importance of preventing these occurrences and offer some solutions for funding to help improve the programs for prevention. In 2016, the Centers for Disease Control labeled deaths by opioid overdose as a national epidemic. Opioid overdose is now the leading cause of unintentional deaths of people under the age of 50 in the United States. According to the North Carolina Department of Health and Human Services, the number of deaths in North Carolina due to medication and drug overdoses has been drastically increasing yearly since the year of 1999. The majority of these deaths are unintentional. In 2015, an average of 5 people died per day in the state of North Carolina alone due to unintentional drug overdoses. The number of deaths grew from 363 deaths in 1999 to 2,074 deaths in 2017. This is an increase of 508% during this time period. That means that 5 times as many people died in 2017 than what died in 1999 from these overdoses. The largest medication culprit in this epidemic has historically been opioid overdoses, but unintentional deaths by illicit and illegal medication drugs such as heroin and synthetic narcotics are also on the rise now as well. Because of this epidemic that is not only affecting North Carolina, but the United States as a whole, it is imperative that our local government and legislators do something to help prevent these unnecessary deaths from happening. The purpose of this speech is to bring more attention to this statewide and nationwide problem and to propose some potential solutions to the problem. The Strengthen Opioid Misuse Prevention Act, also known as the STOP Act, is a legislative policy that is designed to help reduce North Carolina's opioid misuse by setting new guidelines for providers and helping to improve substance abuse treatment in rehab facilities. The Act applies to targeted controlled substances. These include Schedule 2 and 3 opioids and narcotics. The main goal of the STOP Act is to reduce excessive and inappropriate prescribing of opioids by medical providers. One way that the Act seeks to do this is by setting a limit and only allowing providers to prescribe a maximum of a 5-dose course of opioid pain medications for patients complaining of acute pain, or a 7-day course of opioid pain medications for patients following an operative procedure. Pharmacies will now be required to report targeted controlled substance prescriptions to the North Carolina Controlled Substance Reporting System by the end of the business day that the prescription is dropped off. In the past, they had 3 days to report the prescriptions to the North Carolina Controlled Substance Reporting System. Prior to prescribing these types of medications, providers will be required to review the 12-month prescription history of the patient in the North Carolina Controlled Substance Reporting System and document that they did so in the patient's record. Physician's assistants and nurse practitioners working in the pain clinic settings will now have to have a personal consult with the supervising physician prior to prescribing a targeted controlled substance, and they will be limited to a 30-day prescription. They will also have to have another reevaluation with the supervising physician every 90 days. The Act also amends part of the Good Samaritan Law to now allow Narcan, which is the reversal agent for opioids and narcotics, to be given by organizations that have standing orders to do so. This includes first responders such as emergency medical technicians and law enforcement officers. All these changes that the STOP Act has proposed to put into place are necessary in order to regulate and decrease the number of opioids that are being prescribed. But another area that needs drastic improvement as well are the drug and rehabilitation facilities. According to the Centers for Disease Control, the majority of heroin and fentanyl users admit that prescription opioids were the beginning of their drug addiction abuse. With the growing epidemic of unintentional drug overdoses, it is vital that drug rehabilitation facilities are more accessible and have better programs in place in order to help these people with their addictions and prevent unnecessary deaths. In order to be able to accomplish these goals, more state and government funding is necessary for these facilities. For the remainder of this speech, I would like to propose a plan to help the drug rehabilitation facilities to receive the funding that is needed to help these patients and ultimately save many individuals from becoming yet another casualty of this epidemic. I am proposing a federal grant to help finance the STOP Act and help strengthen and improve drug rehabilitation centers across the state of North Carolina. Federal grants from the government are awarded every year in order to help programs and new policies that benefit the public. What better way can we benefit our public than to help save them from themselves and to stop these unintentional drug overdoses? This type of financial assistance has been around for years. It was founded with the Constitution when it promised to promote the general welfare of the United States of America. The federal grant aid that I am proposing would be a $31 million grant to help North Carolina combat the opioid epidemic across the state. The grant funds would be dispersed over a 2-year period of time, with 80% of the funds being contributed to drug and treatment rehabilitation centers. It would specifically be used to fund drug outreach programs, treatment programs, and recovery services. The grant funds would come from the Substance Abuse and Mental Health Services Administration, and it would be given to North Carolina Department of Health and Human Service Division of Mental Health to disperse and determine which facilities have the highest needs and would benefit the most from the funds. It would help approximately 3,000 individuals across the state of North Carolina in this 2-year period of time to receive the substance abuse treatment that they need. It would focus on helping the minorities in the state and also those in rural areas that have less access to rehabilitation centers in their area, specifically those that don't have access due to transportation issues. From my experience of being an emergency department nurse, I know that rehabilitation facilities can be very difficult to get patients into due to lack of beds and the increasing demand for these beds. The funds will be given towards facilities that use evidence-based practices such as medication-assisted programs that have been proven to be effective in the treatment of opioid and narcotic dependence. It will help to fund recovery programs to follow up with those patients living in rural communities following discharge from drug rehabilitation centers. In my eyes, prevention is the best policy. If we are able to help these patients recover from opioid and narcotic dependence, then we can help to prevent these unintentional overdoses before they happen. In conclusion, with this growing epidemic nationwide and specifically in the state of North Carolina, it is important that the government and our local legislators take action in order to decrease the number of casualties related to unintentional opioid and narcotic overdoses. As an emergency department nurse, unfortunately, I have had the responsibility of trying to revive these patients and have not always been successful. I have had to stand there with the physician as they give the news to the family members that we were unable to revive their loved ones and that they will never see their loved ones alive again. This is heartbreaking, and it is not something that I want to have to continue to do. As a nurse and as an advocate for my patients, I want to do all that I can do in my power in order to decrease these incidences. One way that we can do this is by funding and implementing the STOP Act. Imagine if by the year 2020, we can say that we were able to decrease the incidence of unintentional opioid and narcotic overdoses by at least 50% or more, instead of it continuing the trend of increasing as it has been doing in the recent years. I want to make a difference in saving lives in my local community and state. Now I ask you, do you want to make a difference in saving lives as well? Thank you for your time.